is the message that's being sent, and the intensity of it is higher than any that I have ever observed in my years of service, and I thank them for it, because there's a chance that we could stop this, start beginning in January. We'd all be willing to come back, sit down together, negotiate with the C-SPAN cameras, as the President said, committed that he would do as the candidate, and we'd sit down together here at the White House, anywhere, and fix this system, which we all know needs fixed, because, as the senator from Oklahoma said, it's the cost that has to be, not the quality.
I'd like to bring up an example, which is we're going to see time and time again if this bill goes through. We had the U.S. Preventative Health Task Force put out a recommendation on breast cancer screening through mammography on the basis of cost. And what they said is it's not cost effective to screen women under 50 with mammograms, because you have to screen 1,900 before you find one breast cancer. But comparing, and on cost, they're right, but over 50 you have to screen 1,470. So what we had was a decision that was made on cost, not on quality, not on patients, based on cost. Now, we fixed that as one of this bill. We actually fixed that. There's 3 different agencies within this bill that are going to do the same thing. And every time they make a ruling based on cost, not based on clinical outcomes and what's best for patients, are we going to fix it? No, we're transferring the care of the American patient to 3 bureaucracies within the federal government, and they're going to decide what you have to do. And if you think about it, just this week, a member of this body's wife was diagnosed with breast cancer. And she was diagnosed through a mammogram. And under that task force recommendation, she wouldn't have gotten it.
But I asked the senator from Oklahoma, would that aspect of this bill come to light if it hadn't have been for the recommendation that was made by another but similarly acting policy-making body? In other words, that's what's triggered the investigation of what was in this bill, which would have had exactly, if we hadn't had that information of a recommendation by another government policy-making bureaucracy, we would not have known about this until the bill would have actually taken effect.
So there is no transparency. And what we do know that is transparent is that we're going to have 3 organizations, the Medicare Advisory Commission, the Cost Comparative Effectiveness Panel, and the U.S. Preventative Health Task Force that's going to tell everybody in America what they're going to receive.
This example would never have been known if it hadn't been for the actions of a bureaucracy in being. So then doesn't that bring into question what else is buried in this 2,000-page piece of legislation?
What are the unintended consequences of this? And they don't know. What we do know is there's 70 new government programs. They're going to require over 20,000 new federal employees with 1,690 different times when the Secretary of HHS is going to write rules and regulations about your health care in America. The Secretary, not your doctor. Not your doctor is going to write the rules and regulations about what your best care is. The Secretary of HHS is going to write the rules.
And let me just point out again that we don't know what the CBO estimate is, because we know that the majority leader keeps bouncing proposals back to CBO back and forth. That's why we don't have any CBO information now for many days. But there is the Commission for Medicare and Medicaid that clearly points out that this legislation would increase taxes dramatically, increase costs dramatically, and decrease care, and would have the effect of forcing people not only out of the system, but even if they're in the Medicare system, they would not have physicians to provide the care, because more and more physicians would fail to treat Medicare patients.
72 hours. We're going to get a new bill. We're not going to have the opportunity to amend it. We're not going to get the time to read it and study it. The American people aren't going to get the time to read it and study it. What do you think the outcome of that's going to be?
Well, I think we know that what the outcome, we'll either be able to reflect the feelings and the intense feelings of the American people about, the majority of the American people about this legislation, and say, let's go back to square one. Let's all commit to a bipartisan approach to this issue. Or we will see jammed through on Christmas Eve legislation that will have the most far-reaching effects and devastating effects, I think, not only on our ability to provide much-needed medical care to all of our citizens, but also impact that would be devastating on the debt and the deficit, which we have already laid an unconscionable burden. So we really have two choices here, it seems to me. Go back to the beginning, any of the reforms that we could agree on, and there's many of them that we could agree on immediately and on a bipartisan fashion. And as the senator from Tennessee pointed out, there has never been a fundamental reform made in the modern history, that was not bipartisan, or we are going to see jammed through, over the objections of a majority of Americans, legislation that they've never seen nor read or understand. So that's really the choice between us. That's really what this choice is boiling down to. And I think that, frankly, the American people should be heard, not a majority over on the other side.
The American people are saying, don't cut my Medicare, don't raise my taxes, don't make things worse than they are right now. And this bill raises taxes, and for people depending upon a health care system in this country, this makes things worse.
By the way, could I mention that, you know, if you live long enough, all things can happen. I now find myself in complete agreement with Dr. Howard Dean, who says that we should stop this bill in its tracks. We should go back to the beginning and have an overall bipartisan agreement. Dr. Dean, I am with you.
The senator from Pennsylvania.
Mr. President, I ask consent that I may speak up to 20 minutes.
Without objection.